You've tripped. You've got a hurt ankle and you're wondering what to do about it. My name is Beverly Bitterman, ARNP, Health and Wellness Consultant, with some strategies for dealing with strains and sprains. So the first thing that you want to do when you've got an injury like that, it could be a sports injury, it could be something from being a weekend warrior fixing things around the house, is use the principle called RICE. R stands for rest. So in other words, if you have a sore joint like a knee or an ankle, you want to rest it. You want to stay off it. I stands for ice. So putting ice on the affected part, the ankle or the knee, is a good idea. C is compression. You can use something like an ACE bandage to wrap it, and you always start away from the heart to wrap an ACE bandage. So if it's on an ankle, you would start near the toes and you would wrap towards the knee. And then the last thing is elevate. And what you would do is you would put the affected part, the ankle or the knee, above your heart. So you could lay on the couch, for example, and elevate your leg. The next thing you want to pay attention to is how bad is it? In other words, do I need to go see the doctor? If you heard something rip or tear, then that's probably a time when you might want to get in to see the doctor. You could probably decide whether it's throbbing enough or feeling bad enough that you need to go that day, or can you actually get an appointment rather than going to the emergency room. So that's a choice you're going to have to make based on how bad you feel. Meanwhile, using the RICE principle, rest, ice, compression, and elevation, is something that you can do. Also take something for the discomfort, something like Tylenol or Advil. Because you may have some bleeding into that joint, we wouldn't recommend aspirin in this case. So you would keep up these principles, the RICE principle, for a few days. If it's a simple sprain, it's probably going to feel better and a little better in maybe 3 days, and probably be about gone in 7 days. If it's worse than that, it's going to take longer. If you feel like you can't step on your foot and bear any weight at all, that would be another reason to go to the doctor. Or if there's any misalignment, if it just doesn't look right, it's another reason to go to the doctor. Do expect some swelling, expect some bruising. It'll be red and then blue and then yellow. And I wish you good luck with getting rid of your soreness. Beverly Bitterman, ARNP.